Hello, we are talking about peripheral arterial diseases today. Peripheral arterial diseases are one of the significant health problems, especially in elderly age group patient, and also with increasing diseases like diabetes. They are seen in much more younger population now. So what happens basically in peripheral artery diseases, there is gradual blocking of the blood vessels. Initially, to begin with, these blockages can be mild or moderate, and later on, as this disease worsens, they can present with significantly morbid or conditions, and resulting in lots of complications. So peripheral arterial disease would mean diseases of the blood vessels that are present throughout the body, excluding those which are supplying the heart and those are inside of the brain. So there are certain risk factors that can make you prone for developing this disease. One of them is smoking. Smoking is the single most preventable cause of vascular disease. The other things which risk factors include diabetes, hypertension, altered cholesterol, lipid abnormalities, and of course is age. So these diseases can present differently depending on which territory of the blood vessels is involved. Like say in case of legs, which is quite common, I would say they present with claudication pain, that's a limping pain that again when they walk, or the severe form of the disease in which you get rest pain, where the pain is continuous in the toes, which is quite relentless and does not subside with painkillers. The same thing happens in brain. We can have mini strokes, which is a milder form, and if it is severe form, because of the blockage of the circulation to the neck and the brain, we can have strokes. And also in case of intestines, it can cause pain that comes on taking food, and in later stages it can cause intestinal failure. And also with the kidneys, it can cause renal infarction or damage to the kidneys, which result in long-term dialysis. So these are the symptoms we can have with peripheral arterial disease. So how do we diagnose this? We do a thorough analysis of the history. We conduct a thorough clinical examination. We order some investigations. Ultimately, the idea of doing all this is to get an information about how severe is the disease, whether this needs treatment, if this needs treatment, whether it is going to be something simpler or a complex procedure, and to what an extent your patient, the patient can tolerate it and benefit from it. So usually the treatment options are medical management in earlier stages with modification of risk factors and medicines. And in especially at this point, I would like to stress that many of the patients who present with this peripheral vascular disease will have disease in other segments as well. So they are equally at risk of developing a coronary artery disease or a heart attack or a stroke or an intestinal failure. So these patients have to be identified and the risk factors modified properly so that we have some protection against these diseases. We have newer treatment options like angioplasty and stenting, wherein we utilizing small tubes and catheters, we reach the place where the block is without making any cuts or incisions. We stretch the arteries, open them up, and sometimes we may leave behind a metallic cage called stent to leave them open. And in patients with whom we cannot offer these treatments, we have surgical options wherein we can do a bypass procedure utilizing vein or artery. Single most important factor remains in these patients even after the surgical intervention or treatment is long-term surveillance and follow-up, which is provided at our center. Controlling of risk factors remains an important step and will help in the long-term benefit of these patients. Thank you.